Head injuries are common, and while some may appear minor, they can quickly become serious. It is important to remember that not all problems are immediately obvious to the first aider. The brain is a sensitive organ, protected by the skull and surrounding fluid, but injury can still occur. With any head injury, you should always consider the possibility of spinal injury. Assess how the incident happened and minimize movement wherever possible to avoid further harm. One of your first priorities is to assess the patient's level of consciousness using the ACVPU method: alert, confusion, voice, pain, and unresponsive. First, alert. Is the patient fully alert with eyes open, responding appropriately, and able to hold a conversation? Next, confusion. Is the patient confused compared to their normal behavior? New confusion is a serious sign and may indicate a worsening condition. Then voice. If the patient is not fully alert, do they respond when spoken to, such as opening their eyes or following simple commands? Next, pain. If there is no response to voice, check for a response to painful stimuli, such as movement or abnormal posturing. Finally, unresponsive. If the patient does not respond to voice or pain, this is a medical emergency requiring immediate action using the ABCDE approach. Always record your findings and reassess regularly, as changes in consciousness can indicate deterioration. If you have any concerns, call 999 without delay. Head injuries can affect behavior as well as the physical condition. A patient may become confused, drowsy, or act out of character. There may not always be a visible injury, as force can travel through the body and affect the brain. A concussion is a common type of head injury caused by a blow or jolt to the head. It results in a temporary disruption of brain function. Symptoms may include headache, dizziness, nausea, confusion, memory problems, and feeling dazed. More serious is cerebral compression, where pressure builds up on the brain due to swelling or bleeding. Signs include worsening consciousness, severe headache, vomiting, unequal pupils, and weakness on one side of the body. This condition can develop immediately or several hours after injury. A skull fracture may be indicated by fluid or blood from the ears or the nose, bruising around the eyes, or visible deformity. Treatment for head injuries follows key principles. Always consider spinal injury, control any bleeding, call emergency services, and keep the patient still. If appropriate, lay them down with the head and shoulders raised slightly, monitor breathing closely, and do not give food or drink. If the casualty is wearing a helmet, it should usually be left in place, as removing it may worsen neck injury. Only remove a helmet if you cannot maintain the airway or if the patient is not breathing. If removal is required, it should be done carefully by two people, one supporting the head and neck and the other removing the helmet slowly after undoing the strap. Throughout the incident, reassess the patient, keep them warm, and monitor their condition. Early recognition, careful handling, and prompt action can make a significant difference to the outcome.